All right, can you see my screen?
Yes.
Okay, so we are talking about infection control.
hmm
So this is what I asked you to do the last time. Now I want to evaluate. Now, infection control is broken into three parts, right? When you are trying to study for infection control. Now, the first part is the precaution part, knowing all the precautions. That's the first part. The second part is what I call the identification part, right? Now, that is when you try to identify the infection that the NCLEX provided in the question or the sign and symptom related to that infection, right? You identify it and you place it in one of that precaution,
hmm
right? Now, the last part is when you now apply the precaution. That's when you now apply the precaution. Let me just put precaution. Right. Let me just say the first one is knowing the uh, levels of precaution. Right. So now it's just like right now, NCLEX can give you a question and then they will give you the particular infection. For example, let us say they gave you TB, right? The first thing you need to do is you have to think about the level, right? That's the first thing you need to do. Think about the level.
hmm
Identify the infection. Think about the levels we have. Now, when NCLEX want to test you related to infection, right, they can test you related to all these levels. It can be standard, it can be airborne, it could be droplet, it
hmm
could be contact, it can be immunocompromised, uh, something like that. Right, immunocompromised. Now, so we have 1, 2, 3, 4, 5. This NCLEX don't really focus on this. NCLEX is more on these three, right? And
hmm
little on this. So most of the time, this is where your question is coming from.
The airborne droplet,
Contact.
contact, and
Exactly. En-
immunocompromised.
exactly. NCLEX can give you infection related to standard, but it's just like a distractor in most questions because this is the most let me say infections that are most contagious, right? So NCLEX is more on those ones than this, because for standard precaution, you don't need to put them in a room. And NCLEX want situation whereby, as a nurse, you understand the right room, the right PPE, the right
hmm
hand hygiene, the transport rule, and quarantine rule as well too, related to airborne, right? Droplets
hmm
and contact, all these things right here.
hmm
So that's what I want to evaluate now, because that's the first thing. You firstly think about the list of precaution or the level of precaution. You think about disinfection. So when you know we have standard, we have airborne, we have droplet, we have contact, we have immunocompromised. Now you are going to ask yourself, this TB fall under which of this? Now you will not say,
Airborne.
oh, it fall under airborne. Now, since it fall under airborne, that is now the first and second step done. Now, the next thing you will now apply the precaution, which is what? Airborne precaution. So you will read the stem of the question, because this is always the body of your question. You will now read the stem of the question to identify what the stem is testing. Is the stem trying to test you alongside with the answer, trying to test you related to the correct infection control or the wrong infection control? So that is what you will see on the stem of the question, and then your answer will not be related to either room, right? Your answer will be related to either the room, the PP, and the hygiene, transport through, quarantine. It's always like that, Right. So let's evaluate this to see what you know and what you don't know. Right. So I'm going to rewrite this again in this format. Right. So let me start with the PPE, followed by the room, followed by hand hygiene, followed by cohorting rule, followed by transport rule. Now, so let's start with airborne.
Mm-hmm. So the PPE, do you want me to go off
Yes.
of
Yes.
follow
So
it?
for I will ask you the question. So PPE,
Okay.
let's start with the PPE. So what is the PPE that we use for airborne? We have 3 points for this.
Hand hygiene. No, I'm sorry.
For PPE,
Fit test, N95,
N95, that's what
gloves.
we use for airborne, right?
Yes.
All right. Now, when you, because right now this is a patient room, right? And this is you right here as the nurse. Now, when do you put on your N95? Do you put on the
Upon
N95 when you are going inside the client room or when you are already inside the client room?
when you going into the client room, you put on the
When you are going.
N95.
Okay, so that's correct. Now, last question related to PPE. Now, you are in the client room now. Where do you remove the PPE? Do you remove the PPE inside the client room or when you are outside the client room?
When you by the door before you exit the client room, you remove the PPE.
All right. I want you to notice something. NCLEX is not complicated, right? You don't need to overthink it, right? The simple process is, where do you put on the PPE? Is it when you are putting on? This first one is like putting on the PPE, right? Is it in or out, right? You don't need to attach anything, whether by the door, is either you are putting on the PPE inside the client room or outside the client room, right? That's what you should think about. Now, when you are putting off, right, the PPE is also this as well too, in or out, right? That's what you should focus on. NCLEX is not complicated. So the moment we start attaching any other thing to it, that is where we start having problem when we see the question on the exam, right? So let's start the process again. You said the PPE, right, for airborne is N95, which that is correct. Nothing more. N95, that's what you will see on the NCLEX exam. Now you are this. We have two situations right here. This is the client room. This is the client room as well too. Now the first one is related to this. You are about to care for a client who have TB. Now you are about to put on your PPE. Do you put on the PPE when you are inside the client room or outside the client room?
Outside.
All right, that is correct. Now, when you are trying to put off the PP, right? Because
Mm-hmm.
this is outside. Now, are you putting off the PP inside the client room or outside the client room?
Inside. When you're taking it off inside.
Okay, why are you putting off the PP out inside the client room for airborne?
Because you don't want to transfer everything that's in the inside outside. So you you don outside, doff inside.
Okay, let me explain something to you. Now, this is the room.
Mm-hmm.
This is the patient right here who
Mm-hmm.
have TB, and this is you right here. But you have
Mm-hmm.
like your PP on. Let me just put something like that. You have your PP on, covering your face. Now, the patient is still here inside the room. You are still inside the room. The patient have the ability to cough. The patient have the ability to sneeze, right? So
Mm-hmm.
now you've been caring for this patient. This patient have been coughing. This patient have been sneezing. Now you now remove your PP inside the client room. Guess what? When you walk out of this client room, you are walking out with TB yourself.
Okay.
Do you understand?
Mm-hmm.
Because the safety concern right here is because the reason why we're using PP is because we want to protect ourselves from this TB or airborne droplet. That is the reason why we don't go inside the client room to put on or don our PP. because we are trying to protect ourselves, there's possibility that if we enter the client room and decide to put on or don our PPE inside the client room, the client can sneeze any moment, and guess what? We are going to get that airborne droplet, and we are going to have that airborne infection. So it's also safe that you don't remove your PPE inside the client room. Instead, you remove it outside the room.
Okay.
Right? So that the client don't sneeze while you are removing it, because now you are not protecting your face. Anything can happen. So you put on outside, and then you put off outside.
Okay.
Right? I will still give you the shortcut to this, but let's just leave it like that. I'm still trying to evaluate. Right. Now, that is that for the PPE. Now let's go to the room. What room do we use for airborne?
Negative pressure, private room.
All right, negative pressure, private room. Now that's that for the room. Now another last question that I was related to room is: do we close the door or no?
The door should be closed.
Yes, should we close at all time? All right, so that is correct. Right. So now next is hand hygiene. Now, what hand hygiene do we use for airborne?
We can use soap and water or the hand sanitizer.
Soap and water or alcohol-based hand rub. We have two types of hand hygiene. We use soap and water and alcohol-based hand rub. That's the two that we have, and they are very good for airborne. Right. So that is correct. Now, for the cohorting rule, right? Do we cohort with airborne or no?
No.
No. All right. This is correct. Now, for transport rule, what do we do for transport during transport?
Make sure that the resident have on a mask before transferring them from
Surgical
room to
mask.
room. Yes. No, it should be an N95. Surgical mask is for like droplet, right?
Okay, so there's also misunderstanding here. Now, during transports, this involves the client. So the rule applied to the client. What PPE would the client use? The PPE that the client use is surgical mask.
Okay.
The PPE that staff or visitor we use is N95. So
Okay.
transport rule involve the client. So the PP is surgical mask. So transport will be surgical mask. Exactly. Exactly.
Mm-hmm.
All right.
I was
Great.
already there. Yeah, that's good.
Okay. Great. So that is it. So for this session, you had 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6, 7, 8. So 6. Right. That's what you had. The only issue you had is not knowing where you remove the PPE. It's outside, right? And the transport room, right? So now let's do same real quick for droplet.
Mm-hmm.
So tell me, what is the PPE for droplet?
For droplet, the PPE should be hand hygiene, regular surgical mask, and private room.
PPE.
Surgical mask, gloves, and I think a gown.
All right. The PPE, there's also misunderstanding for droplet. Airborne is N95.
Mm-hmm.
Droplet is surgical mask.
Mm-hmm. I
That's
got
it.
that part.
Huh?
I said I got that part. So it's not gloves and gown
No, it's
for
not glove and
droplet.
gun. No.
Okay.
All right. Now, for the PP, where do we put on the PP and where do we put off? So it's inside or outside?
I'd say put on inside. No, Put on outside, take off inside.
Inside.
Yeah.
All right. It's also outside.
Okay, so for both of them.
You put off outside. Now that's the shortcut I wanted to say, explain to you earlier on, right? Airborne and droplet. We it's outside for everything.
Okay.
So when you remember airborne droplet, remember outside in a sense that we put on the PPE outside and we put off the PPE as well too outside. They are the same. All right. So that's it. And now for the room, what room do we use for droplet?
The droplet room.
What
I
room?
I still believe that you use the private room for droplet as well, and you still can't room them with other people.
Yeah, we use the private room. Do we keep the door closed or open?
You could keep it open.
All right, that is correct. We can keep it open, private room. Now, what hand hygiene do we use for droplet?
Soap, water, alcohol base.
All right. For quartering rule, what is their quartering rule? Do we quart or we don't quart?
You still don't court because just because they got the same thing don't mean they can room together, right?
Okay,
Or is
I
it
don't
only
understand.
with
Do you quart with droplet or no? Yes or
no,
no?
I don't no.
No. Why?
Because just because they got the same infection don't mean that they could room together. One could be more severe than the other, right?
Okay, for droplet, we quart. Quarting is applied to droplet. Quarting is not applied to airborne, but it's applied to droplet. The only special rule is that you can have a droplet and another droplet client. Let me put it like this. Take for instance, right now, we have only one room right here, and then this client and this client, they have infection, and then the nurse right here got to realize that these clients have a droplet infection and also this client have a droplet infection. This nurse can court the two of them together in this one room that we have right here. But the rule is that the both clients must have the same infection.
Mm-hmm.
There's difference between having the same precaution and having the same infection. The precaution is that we are going to utilize droplet precaution. The infection now is that are we having the same infection and not a different droplet infection? For example, a patient who have pneumonia and a patient who have influenza, right? They are both what? Droplet
Droplet.
droplet infection. But guess what? They are not the same infection because pneumonia is different from what? Influenza. So we cannot quote these two together. But if we have pneumonia and another pneumonia client, this is a good quoting rule. If we have influenza and another influenza client, this is a good rule for quoting. Exactly.
Mm-hmm.
All right. Now, transport rule. What is the transport rule for um droplet?
Surgical mask.
All right, during transport. So that is good. Surgical mask during transport. So let's move on to contact. So what is the PPE that we use for contact?
Brown gloves and disposable equipment.
PPE, when we talk about PPE, right,
Oh,
we are talking
mm-hmm.
about personal protective equipment, right? We are not talking about materials. We are talking about personal protective equipment. What are you using to protect yourself as the nurse, right? So the PPE is only
Gown
gown.
and glove.
Okay, great. So the PPE, right? This is your patient room, right? Do we put it on inside or outside? And do we put it off inside or outside?
Inside prior to you touching everything, and then take it off inside before you go out and touch things.
So you put it on inside and you put it off inside. Is that what you're saying?
Yes.
Okay. Now, every of these airborne droplet contacts we put on the PPE outside, everything. But airborne and droplets, we
You
put
take
it
out.
off. We put it off what? Outside. Right.
Okay.
But contact is the one that now that change. When we are trying to put it off, we put it off inside. Do you understand?
Mm-hmm.
Right. Let me put it in a different way again. Right. The whole goal is having our PPE and knowing if we put in, like when we are trying to care for the client, right? Do we put on inside or outside? And put off inside or outside. That is the whole goal. That's what we want to do. Right. Now, for airborne droplet contact, when it comes to putting on, we use outside. So outside, 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 everything. Right.
Mm-hmm.
But when we are trying to put off, we put off outside, outside, inside.
Inside.
Right. We are trying to we put off the PPE for contact inside because we don't want to take the infection outside. You remember we have used a lot of this PPE to directly touch the infection.
Mm-hmm.
So we don't want to transfer it to places that don't have the infection. That's the rule, right? Is that clear? Is that clear?
Mm-hmm.
Okay, great. Now for the room, what room do we use?
With the contact, private room still.
All right, private room. Now for the hand hygiene rule, what hand hygiene do we use?
Soap, water, alcohol based.
Okay, we maintain soap, water, and alcohol base, except when we have a particular condition related to C. diff
Mm-hmm.
or
Or
norovirus, we
norovirus.
don't use
Alcohol based.
alcohol-based hand drop for these two.
Mm-hmm.
But any other contact infection, we can use soap and water and alcohol base. Now, what is the quarantine rule related to contact? The quarantine rule related to contact.
I think you could be with somebody else that's on contact, but it has to be the same condition as you.
Yes, the same infection. That's correct. You can quote, but should be the same precaution, the same infection. Like for example, if you have a client who have scabies, you scabies. Okay, let me put it on the screen. Take for example, right now you have these two clients right here, right, and you have this one room, and you want to quote. Now this client have scabies, and this client have head lice. Guess what? They are both contact, but you cannot quote them together because
Mm-hmm.
they have the same precaution but different infection. But if you have another client who have scabies, right? Yes, you can do this. If you have another client who have lice, yes, you can do this, right? Or any other contact infection that are the same, right? So that's the rule. Now, transport rule don't apply to contact. So transport rule don't apply to contact. Transport rule only apply to airborne and droplets. So this is the end of the session. So how do you feel about infection control?
I feel like a little struggle on when because I'm using my real rule for the NCLEX when I should really do it like the correct way. Because I be thinking like doing it how I do it at work because I take off everything before leaving the room. So
Okay.
now I know I have to take it off outside the door when it comes down to certain um certain isolations.
All right. Okay. Sound good. Now, one thing I want you to remember, like I said previously, this is what infection control is all about. The level of the precaution, identifying the infection or sign and symptom. Because sometimes NCLEX will not give you the infection name, they will give you the sign and symptom. For example, the NCLEX can say a patient is having night sweat,
Hmm.
which is equal to what? TB. Or the NCLEX is saying the patient is having red eyes, which is equal to what? Conjunctivitis, right? Or a patient is having lesion, which is equal to what? A kind of contact infection or vesicle, right? Which is equal to what? Contact infection, right?
Mm-hmm.
Or blister, which is equal to what? Contact infection, right?
Okay.
So those are like sign, or they might tell you patient is coughing,
And we
right? Or
know.
patient is sneezing. This can either be related to airborne or droplets, right? So these are like a smart way to think about it, right? So it's always these three things, the level, the infection name, the symptom related to the levels, and then you apply the precaution. This way you are going to understand fully. But the last part now is now understanding what the NCLEX test related to the infection, right? Which I've listed everything. Is either the NCLEX is testing the room, the NCLEX is testing the PP, the NCLEX is testing the hand hygiene, the NCLEX is testing you on the quart rule, or the NCLEX is testing you on transport rule, right? We have all these 5 things that you
Mm-hmm.
need to. Now, the last thing NCLEX always used to test when it comes to infection control is giving you one room and giving you 4 clients with different infection. So you need to prioritize one of these clients for this only private room. Right. And the rule we use is AIDC, airborne immunocompromised droplet contact. The moment we're trying to prioritize 4 clients for one client from 4 clients, right, to the only private room that we have right here, we use this rule. Now, if you have a particular question right now, and it's telling you who are you going to prioritize to the only private room, right? So the first thing you need to do is to put down this rule, AIDC, airborne immunocompromised droplet contact. So look at all this infection or sign of infection. Ask yourself, can you see airborne?
Mm-hmm.
If you can see airborne, right, then that's the first patient you put in that room. No argument. But if you do not see airborne, then you need to look for immunocompromised clients.
Immunocompromised.
Right. So look for immunocompromised because they are the next in line, right? If there's no airborne. If there's airborne, just avoid every other answer, select your answer, move on. Airborne. But if you do not see airborne, look for immunocompromised. If you see immunocompromised, select it. They are the available patient for the private room. But if you check your answer and you do not see any patients who have immunocompromised, then the next thing, look for droplets, right? If you see
Mm-hmm.
droplets, select the answer, move on. But if you don't see droplets, then the next thing you're looking for is contact. Contact is 100% always going to be there, right? But guess what? NCLEX can mix this answer with airborne, immunocompromised droplet, contact, or standard infection. But remember, we don't prioritize the standard infection when we are trying to prioritize room because they don't need the room. So NCLEX can distract you with standard infection. That's why when you see a condition related to standard infection, you want to exit out so that you can be able to only focus on just this 4 level of precaution, right? So your whole duty is one to know, right? Like I said, the level of precaution which I listed them, and then know the condition or infection or sign and symptom related to those levels. You need to know which one fall under standard, which one fall under airborne, which one fall under droplet, which one fall under contact, and which one fall under immunocompromised. Right. So once you know all these things, then immediately you can now start applying the precautions related to the room, the PPE, right? The hand hygiene, quarantine rule, and then transport. So yes, this is everything related to infection control. Any question before I go?
No, I'm going back to the videos to go look over some more of them.
All right, awesome, great, awesome, great. Okay, all right. So I'm going to see you again next time, right?
Yes, Saturday morning, 8:30.
All right, Saturday. Okay. All right, take care of yourself. Bye bye.
Thank you.